will end up in sometimes life-threatening because the fallopian tube might get ruptured if you are not noticed it early. So now you understood, by merely a lack of clarity or a lack of awareness or lack of understanding should never put your life into a risk. If you got the result and that result is positive, don't stay idle at home for next 1 or 2 weeks without going for a checkup. Now we are into the last and final part of no IUI, no ICSI. No IUI end to end ends with success. So this is the last part. I hope my couples and my viewers and listeners have gained sufficient knowledge, awareness and clarity about IUI. What is this final 12th part is, what is the care after IUI? Already in the 11th part, I have given few informations about post-IUI. I suggested you no need for any relaxation or bedridden activity, or to be confined to bed or refined from activities or anything. So you can be normal, you can do your routine activities, you can resume to routine activities, everything. But only thing is, don't do any strenuous activities. That's all. So now after that, what is the next level? So that is the last step and last part of this 12th video. And what does that mean is, after the IUI, you will be given a luteal support. Some clinicians will give supplements for 2 weeks, 14 days, some luteal support, and some clinicians will give some supplements also. And you are taking the supplements for 2 weeks. After these 2 weeks, you are looking for a pregnancy. Say for example, if you get the periods, okay, let us not be disturbed. As I mentioned, it's a continuous process. So let's go to the next decision, whether it is can be an IUI, or it can be a break, or it can be in next level for IVF or ICSI. But on the other hand, after 14 days, you have not got your periods, which means you are likely to become pregnant. Okay, so wait for another 1 or 2 days. So if after 16 days, if you are not getting your periods, you can do a urine pregnancy test with your pregnancy card at the home side itself. If you are getting positive, very good. But if you are getting negative, don't be disturbed. Sometimes early pregnancy are not picked up in urine pregnancy test. What you can do is, if you even after 16 days you are not getting results, please go to your treatment center and go for a blood confirmation pregnancy test, that is called beta HCG. Okay, so this test has to be performed, and if the results turns to be positive, a very happy news, a welcoming news that you got the desired results and you become IUI positive. So that is the first step. So in that, what you need to do is, certain precautions has to be taken place, some awareness has to take place. After this, within the next 2 weeks, the doctors will ask you to come for a scan. This is to ensure that the embryo has really got implanted in the uterus. The embryo should not get implanted anywhere outside the uterus. Suppose if the embryo is getting attached to the fallopian tube, the passage where the embryo is traveling all the way back from the fallopian tube down to the uterus from day 1 to day 6, that passage should not get blocked. The embryo should not get implanted in the fallopian tube, because it's merely a passage. It's not having a sufficient space, or it's not the place for the embryo for the fetus to grow there. So the uterus is the right place for the fetus to grow for 10 months, right? So if there is an ectopic pregnancy, any non-uterine pregnancy, we call it as ectopic pregnancy. If the pregnancy is non-uterine, it's called ectopic pregnancy. So what happens is, in ectopic pregnancy, it will end up in sometimes life-threatening, because the fallopian tube might get ruptured if you are not noticed it at early and not terminating that pregnancy by medications. So what happens is, this ectopic pregnancy, if left unnoticed, it will rupture the fallopian tube. One, immediate emergency, some intervention, either laparoscopy or open procedure, to stop the bleeding and discontinue that, remove the fallopian tubes. By this is a preventable complication. Because of lack of awareness, because of lack of proper follow-up, you are ending with losing the fallopian tube. If you lose the fallopian tube, what will happen? You lose the chance of subsequent natural conception or IUI conception. You have only one choice. You can go for only IVF or ICSI. So now you understood, by merely a lack of clarity or a lack of awareness or lack of understanding should never put your life into a risk or should prevent you from getting the easy way of pregnancy in the future. Okay, so this is the most important thing that you need to keep in mind. And even after this, say, even if the embryos got implanted in the uterus, the gestation sac is picked up, you are going to go for repeated scan every 2 weeks. That it is just to confirm you are getting the heartbeat. If the heartbeat is happened, you have got one step ahead. It's become a clinical pregnancy. From biochemical, you have gone to the next level of clinical pregnancy. So the most important thing is, you need to have a constant follow-up. Don't ignore at any point. If you don't got the result, you have to go. If you got the result and that result is positive, don't stay idle at home for next 1 or 2 weeks without going for a checkup. So these are my strong informations and awareness to the female partners who have undergone the procedure. So this is to ensure that you are not missing out. So I hope you got the complete clarity about the beginning till the end and after IUI. Hope this is a very informative topic, and many female partners and many couples have got the true benefit, awareness, understanding and clarity. So hopefully try IUI if it is needed for you with lot of positivity and ensure that you are getting success. If not the success, definitely you are going one step ahead and you have got very well prepared for IVF and ICSI. Not only ending up with biochemical pregnancy in IVF, you need to get a live birth rate in IVF or ICSI by a strong preparation during the time you have taken to undergo the IUI procedure and IUI preparation. Hope, wish you all the best. See you with your babies. Good luck. See you in a very next topic about infertility sessions. Good day.